Okay, so you're here with us because you like to get to the bottom of things, right?
That's right.
I want to skip the fluff
Yeah.
and understand what really matters.
Yeah.
And you want to do that fast.
Yeah.
You don't want to spend hours researching something just to feel in the know.
Absolutely.
And that's what we're all about here on the Deep Dive.
Exactly.
So we're going to go dump today on something I think everyone listening has dealt with at some point.
Oh, yeah, for sure.
Pharmacies?
Pharmacies. Yeah. Everyone, I think, has been to a pharmacy.
Right, exactly.
At some point in their lives.
So think about how often you might interact with a pharmacy, maybe even without realizing it.
Yeah, that's true.
Like it could be picking up a prescription.
Of course.
It could be grabbing something over the counter for a headache.
Yeah, just something small.
Or even just asking a quick question.
Oh, yeah.
Like, hey, what is this thing?
Sure.
So these are just like really normal, everyday situations.
Yeah.
But even in these situations, having a little more knowledge can really empower you and even like impact your health and well-being.
Right. If you know more about what you're getting into, you're going to have a better outcome.
Exactly.
And you're going to feel better about the situation.
For sure.
Yeah.
And the material we have for this deep dive today is like spot on.
Yeah.
It comes from an educational resource that's designed to help people navigate everyday English.
Okay.
Specifically in the pharmacy setting.
That's great.
So this is like real nitty-gritty stuff.
Yeah.
It's not just like abstract information.
Right. Practical.
Yeah, this is practical vocabulary and phrases
yeah.
that you can literally use the next time you walk into a pharmacy.
Awesome.
So what I really like about this is it's direct.
Yeah.
It's like, here's what you need.
It's right to the point.
Yeah, to communicate effectively.
Yeah.
And understand what's actually happening.
Totally.
Like during your visit.
Yeah.
And our goal today is to basically extract that key information from all these resources and give you like a real shortcut.
Oh, I like it.
To feeling confident and comfortable. Awesome. In this setting.
Yeah.
And, you know, we might even point out a few things you maybe hadn't given a lot of thought to before.
Yeah, I mean, that's the goal, right? You walk away learning something new.
Exactly. All right, let's jump right in.
Let's do it.
Okay, so you walk up to the building.
Okay.
What do you see on the sign?
Ooh, good question.
Right.
Usually I see pharmacy, but sometimes it's chemists or even drugstore.
Oh, yeah, that's right.
So what's the difference there?
Yeah, are these fundamentally different places?
I mean, for the most part, no. They all serve the same core purpose.
Okay.
Which is to dispense medication.
Right.
But there are some, slight differences. So You're right. Pharmacy, that's probably the broadest and most common term.
For sure.
Especially in the U.S. Mm-hmm. Chemists, on the other hand, that's much more common in British English.
Okay.
So if you're across the pond, you're probably going to see chemists more often.
Gotcha.
And then drugstore, that often implies that they're selling a lot more than just medication.
Yeah, like what kinds of things?
So you're going to find your toiletries, snacks, maybe even some household goods.
Interesting.
It's more like a one-stop shop for various needs.
So it's more like a general store, but with a focus on pharmaceuticals.
Exactly.
Gotcha.
But at the end of the day, if your main goal is to get medication or talk to a pharmacist, you can pretty much achieve that at all three.
Okay. So regardless of the sign, you can probably get what you need.
Exactly.
Okay, cool.
Yeah.
So let's move on to something really important.
Okay.
This is a really fundamental distinction.
All right.
Prescription versus over-the-counter medication or OTC medication.
OTC. Yeah.
This is crucial.
Yeah.
For anyone who's ever going to step foot in a pharmacy.
Totally. I mean, this is like pharmacy 101. This is the basis of everything.
Exactly. So can you break that down for us?
Yeah, absolutely. So a prescription medication that requires an order from a licensed healthcare professional.
Okay, so that could be your doctor?
Your doctor, exactly.
A nurse practitioner.
Nurse practitioner, yeah. Anyone who's authorized to prescribe medication.
Okay.
And these are typically more potent medications. Okay. They have a higher risk of side effects.
Okay, so they're not something you just want to take willy-nilly.
No, absolutely not.
You need that, like, oversight.
Right. You need that medical supervision.
Exactly.
And to get your hands on these, you're going to need to show that prescription.
Right.
Whether it's like a physical piece of paper or maybe an electronic order.
Okay.
You got to have that authorization.
It's like your golden ticket.
Exactly. It's like your key to getting those meds.
I like that.
Yeah.
And then on the other side of the coin, we have over-the-counter medications.
Yeah, OTC.
That's the stuff we can just grab ourselves.
Yeah, just grab it off the shelf.
No doctor's note required.
You don't need anyone's permission but your own.
Exactly. So what are some examples of OTC meds?
So you're talking like your basic pain relievers.
Okay.
Like your ibuprofen, acetaminophen, your basic cough and cold remedies.
Yeah.
Allergy meds. Things like that.
So things that you would use for pretty common ailments.
Exactly. Less serious ailments.
Yeah.
That people can typically manage themselves without needing to go to the doctor.
Right.
Which is great because it allows for that self-care. You don't always have to run to the doctor for every little sniffle.
Yeah, I mean, I definitely appreciate that. Like if I can just take care of something myself.
Totally.
Yeah.
But the key here is responsible use.
Yes.
You got to read the label.
Always read the label.
Follow the instructions.
For sure.
And if those symptoms don't improve or if they get worse, then you definitely want to seek professional advice.
You don't want to mess around.
No, you don't want to mess around with your health.
So you walk into the pharmacy, you've got your prescription or, what you want to get over the counter.
Yeah.
Who's the person behind the counter?
I guess the pharmacist.
The pharmacist, what's their role? Beyond just like handing over the pills.
Yeah. I mean, there's so much more than just a pill dispenser.
Yeah.
They're actually highly trained healthcare professionals.
Okay.
They know a ton about medications.
Allie.
Oh, yeah. They're the experts.
Interesting.
They can give you advice on how to use your meds correctly.
Okay.
They can tell you about potential side effects. They can even help you figure out if there are any interactions with other drugs you might be taking or even supplements.
Okay.
And they can even help you choose the right over-the-counter treatment.
So they're like a walking encyclopedia of pharmaceuticals.
Pretty much, yeah. They're like a valuable resource.
I mean, that's amazing.
Yeah.
I didn't realize they were so knowledgeable.
Oh, yeah. They go through a lot of training.
Wow.
Yeah.
So let's talk about the medication itself.
Okay.
It comes in so many different forms.
It does, yeah. Medication. That's like the umbrella term for any substance that's used to treat or manage a health condition. And you're right, it's not just those familiar pills.
Yeah, like what else?
Oh, there's liquids, creams, inhalers.
Oh, wow.
All sorts of stuff.
So like beyond just pills. What are some of the other forms it could take?
Oh, yeah. So let's start with pills.
Okay.
Because even within pills, there's different types.
Really?
You got your tablets and you got your capsules.
Oh, interesting. What's the difference?
So tablets, those are your typical solid pills.
Okay.
They come in all different shapes and sizes.
Yeah.
And they're often designed to release the medication at a certain rate or in a specific part of your digestive system.
Oh, wow. That's really interesting.
Yeah. It's pretty cool how they can do that. Now, capsules, on the other hand, those have like a gelatin shell.
Okay.
And they usually contain the medication in powder or liquid form.
Interesting.
Yeah. So some people find those easier to swallow.
Oh, yeah. That makes sense.
Because of that smooth exterior.
Yeah, for sure. And then there's the liquid medications.
Yeah.
Like syrups.
Oh, yeah. Syrup.
Which are often sweetened.
Yes. Often very sweet.
Which makes them easier to take.
Especially for kids.
Oh, yeah. Kids love syrups.
Oh, yeah. It's like candy medicine.
Exactly.
But gotta be careful with those.
Oh, yeah, for sure.
Make sure they don't get into the medicine cabinet.
Right.
Yeah, and syrups are frequently used for like coughs and colds.
Yeah, those are the ones that come to mind. And then we have medications that are applied externally.
Oh, yeah, your topical medications.
Like what?
So you got your creams and ointments.
Okay, creams and ointments.
Yeah, these are typically used for skin conditions.
Okay.
Like rashes,
Yeah.
eczema,
Mm-hmm.
insect bites.
Okay, so if it's something on your skin,
Pretty much. Yeah.
cream or ointment.
Yeah, and the main difference there is often the base.
Okay.
So ointments tend to be more oil-based,
Oh.
which makes them thicker,
Yeah.
and they can provide a better barrier on the skin.
Interesting.
Yeah. Whereas creams are usually water-based,
Okay.
and they tend to absorb more quickly.
Interesting. So they each have their pros and cons.
Exactly. Yeah,
Yeah.
it depends on what you're using it for.
Makes sense. And then for respiratory issues, we have inhalers,
Oh, yeah, inhalers.
which deliver medication directly into the lungs.
Right, into the lungs.
What's a common use for those?
So asthma is a big one.
Okay.
COPD.
Interesting.
Any kind of condition where you need to open up those airways.
Okay.
Yeah.
Cool. And then for really precise measurements of liquid medication,
Oh, yeah.
we have droppers.
Droppers. Those are great for things like eye drops
Okay.
or even like administering vitamins to infants.
Oh, wow.
Yeah, those tiny little doses.
So many different forms.
So many forms. Yeah.
And they're each kind of engineered for a specific purpose.
Exactly. It's all about getting the medication into your body
Yeah.
in the most effective way
Yeah.
for whatever it is you're trying to treat.
That's amazing. I never thought about it like that.
Yeah, it's pretty cool when you think about it.
So we've talked about the different forms.
Yeah.
But regardless of the form, I think something that's really important to understand is side effects.
Side effects, absolutely.
So what are those exactly?
So these are basically unintended effects
Yeah.
that a medication can have on your body.
Okay.
So it's not the intended effect of the drug. It's like
Right.
the bonus features you didn't ask for.
Okay.
Yeah, and they can range from like minor inconveniences,
Okay, like what?
like a headache,
Okay.
maybe some nausea,
Yeah.
to more serious reactions.
Oh, wow.
Yeah, like allergic reactions.
Okay.
Or even damage to organs in severe cases.
So it's really important to have a conversation with the pharmacist
Oh, yeah.
about what to watch out for.
Absolutely. You want to be informed
Right.
so you know what to expect.
Yeah, and when to be concerned.
Exactly. Being aware of the potential side effects
Yeah.
allows you to be prepared,
Yeah.
and it helps you differentiate between like a normal reaction
Mm-hmm.
and something that actually requires medical attention.
Okay.
Yeah. And, you're often given information sheets.
Right.
But honestly, like, talking to the pharmacist directly can
Yeah.
be so much more helpful.
Yeah, for sure.
They can explain things in a way that you understand.
Yeah.
And they can tailor the information to your specific situation.
That makes a lot of sense.
Yeah.
So we've talked about side effects,
Yeah.
but then there's also like the specifics of how much medication to take
Yeah.
and how often.
Right. That's your dosage.
The dosage, what does that include?
So it includes the amount of medication,
Okay.
the frequency.
Like how many times a day?
Exactly. Like how many times a day.
Right.
And the
How
duration.
long you're supposed to take it?
Exactly how long you need to keep taking it.
Okay.
So you might see instructions like take 1 tablet every 8 hours for 7 days.
Yeah.
That's your dosage right
They're
there.
very specific.
Yeah, it's very specific. And it's important to follow those instructions.
Right. Because if you don't.
If you don't, then the medication might not work.
Right.
Or it could even cause harm.
Yeah. You don't want to mess around with that.
No, you got to take it seriously.
And all these medications come in some kind of packaging.
Yeah.
Right.
They got to put it in something.
Exactly. So it's usually like a bottle,
A bottle, a box.
a box. Yeah. What's the purpose of all that packaging?
So it's there to protect the medication
Okay.
from light, moisture, air,
Okay.
all the things that could degrade it.
Yeah.
But it's also there to give you important information.
Okay. Like what?
So you're going to find the medication name,
Oh.
the strength, dosage instructions,
Okay.
and very important, the expiration date.
The expiration date is huge.
Oh, yeah. You always want to check that
Yeah.
before you take anything.
Because why?
Because expired meds, they can lose their effectiveness.
Yeah.
And they might even be harmful.
Oh, wow.
Yeah. So you don't want to take any chances with that.
Definitely a good habit to get into.
I'll always check that date.
So we've talked about some general terms.
Yeah.
Let's get into some specifics, like different types of medications
All right, let's do it.
that we commonly hear about.
Yeah.
Let's start with antibiotics.
Oh, antibiotics. Yeah. Everyone's heard of those.
So what are they exactly?
So these are drugs that are specifically designed to fight bacterial infections.
Bacterial infections, okay.
Yeah, and that's a key point.
Okay.
They don't work against viruses. So like the common cold, the flu,
Yeah.
antibiotics won't do anything for those.
Okay, so they're very specific.
Very specific, yeah. They target bacteria.
Gotcha. And to get antibiotics, you always need a prescription.
Always need a prescription, yeah.
Okay.
Your doctor has to write you one.
And then another really important point is that you have to finish the entire course.
Yes, you got to finish the whole course.
Even if you start feeling better.
Even if you're like, oh, I feel great.
Yeah.
You got to keep taking them.
Why is that?
Because you got to make sure you kill all the bacteria.
Okay.
If you don't, you run the risk of those bacteria becoming resistant.
Oh, yeah, we hear about that a lot.
Yeah, it's a big problem.
Antibiotic resistance.
It's a growing public health concern.
Yeah, so if you're prescribed antibiotics, take them as directed.
Absolutely. Listen to your doctor and pharmacist.
Okay, good advice.
All right, that's next.
Okay, so next we have painkillers.
Painkillers, also known as analgesics.
Analgesics.
Yeah.
What are those used for?
Those are used to relieve pain.
Okay. Pretty self-explanatory.
Yeah, pretty much what it says on the tin.
I like it.
Yeah. And these can range from over-the-counter options for like your minor aches and pains to stronger prescription meds for more severe pain.
Okay, so it kind of runs the gamut.
Yeah, it's a whole spectrum of pain relief.
And then for those annoying allergies,
allergies, yeah.
we have allergy medications.
A whole category of those.
What are some examples?
So you got your antihistamines.
Okay.
Those work by blocking the body's allergic response.
Okay, so they're like stopping the reaction from happening?
Yeah, they're like putting up a shield.
I like it.
Then you have your nasal sprays.
Nasal sprays.
And those help clear congestion in the nasal passages.
Okay, so if you're all stuffed up.
Yeah, if you can't breathe through your nose.
The nasal spray is your friend.
That's your go-to.
And then eye drops.
Eye drops. Oh, yeah.
For itchy, watery eyes.
Exactly. If your eyes are all irritated from allergies.
The eye drops will help.
Those will soothe those peepers.
I like it.
Yeah.
Okay, so we've covered antibiotics, painkillers, allergy medications.
No, we're making our way through the pharmacy.
What else is there?
Oh, we got vitamins and supplements.
Vitamins and supplements. Okay, so what are those?
So these are generally available over the counter, and they're used to support overall health and well-being.
Okay.
So it's not like they're treating a specific illness.
Right.
It's more like they're giving your body a little boost.
Okay.
Yeah.
So they're not like a replacement for medication.
No, exactly. They're more like a complement.
Okay, I gotcha.
Yeah.
And all of this essential information.
Yeah.
The name of the medication, the prescribed dosage, the specific instructions for how to take it.
All of that.
You'll find that on the prescription label.
The prescription label, yeah.
So this is like your guide.
It's your Bible.
You got to read it.
You got to read it, yeah.
Carefully.
Especially each time you get a new medication or even a refill.
Oh, okay. Yeah, that makes sense because things could change.
Yeah, the dosage might be different.
Yeah.
Or there might be new instructions.
Yeah, for sure.
So always take a minute to familiarize yourself with that label.
So we've covered a lot of ground here.
We have, yeah.
In terms of common pharmacy terms.
Yeah, we've got a good foundation.
Right, but what about actually interacting with the pharmacist?
Oh, yeah. That's the real test.
Right.
Putting that knowledge into practice.
Exactly.
Right.
So what are some key phrases that would be helpful to know?
Okay, so let's say you have a prescription from your doctor.
Okay.
A straightforward way to start is just by saying, "Hi, I need to fill a prescription."
Okay.
Or you could say, "I have a prescription for a name of the medicine."
Okay. Nice and easy.
Yeah, keep it simple.
What if you're not sure if you need a prescription?
Oh, yeah, that happened.
If it's something you can get over the counter,
Yeah.
What do you say then?
You could just ask, can I get this over the counter?
Okay.
Or do I need a prescription for this?
Perfect.
And the pharmacist will let you know.
Easy peasy.
Yeah.
And then once you have the medication,
Yeah.
understanding how to take it is obviously very important.
Absolutely crucial.
Yeah.
So a good question to ask is, how should I take this medication?
Okay.
Because you might need to know if you should take it with food or on an empty stomach or maybe at a specific time of day.
Yeah.
So don't hesitate to ask for clear instructions.
Yeah, I think sometimes people are afraid to ask questions.
Yeah, they feel embarrassed.
But it's really important.
It's so important.
Because it can really affect
Yeah.
how the medication works.
Exactly. It could make the difference between it working or not.
Right, exactly.
Yeah.
And we've talked about this already. But it's worth repeating.
For sure.
Asking about side effects.
Yes, always ask about side effects.
So what's a good way to phrase that question?
You could just say, what are the possible side effects of this medication?
Nice and simple.
Yeah, just get straight to the point.
They'll give you the rundown.
They'll let you know what to watch out for.
What if you're looking for a recommendation?
Yeah.
For something over the counter, like a headache or a stuffy nose?
Yeah, just a common ailment.
Yeah. What do you say then?
You could say something like, can you recommend something for your condition?
Okay, so like, can you recommend something for a headache?
Exactly. Yeah. Can you recommend something for a headache?
Perfect.
Can you recommend something for a stuffy nose?
Easy.
Yeah. And they'll point you in the right direction.
And then what about saving some money?
Oh, yeah. Everyone loves to save money.
Right. So I know generic versions of medications are often less expensive.
Yes. Often much cheaper.
So how would you ask about that?
You could simply ask, is there a generic version of this medicine available?
Oh.
And most of the time there is, and it's just as effective.
Okay. So same ingredients.
Same active ingredients.
But just a different brand.
Yeah, basically just a different name.
And less expensive.
Exactly. So it's a win-win.
Definitely worth asking about.
Absolutely always ask about generics.
So we've talked about asking for recommendations.
Yeah.
Asking about generics. What if you have a specific symptom?
Okay.
Like a cough.
Yeah.
How do you ask for help with that?
So you could say, do you have anything for a cough?
Okay.
Or do you have anything for a sore throat?
Okay. Nice and simple.
Yeah, just tell them what's bothering you.
And they'll know what to do.
Yeah, they'll hook you up.
And of course, it's always wise to ask how much something costs.
Oh, yeah. Especially if you're uninsured.
Right.
Or if you're just trying to compare prices. You don't want to be surprised at the checkout.
Yeah, no one likes sticker shock. And if you're taking other medications.
Oh, yeah, this is a big one.
This is a really critical question.
Absolutely.
What is that question?
You got to ask, can I take this medicine with my other medications?
Okay.
Or are there any potential interactions between this medication and what I'm currently taking?
Okay. So you're basically letting them know what else is in your system.
Exactly, because you don't want any surprises.
Right.
You don't want those drugs to interact in a bad way.
Yeah, for sure.
So tell them everything you're taking.
Even vitamins and supplements.
Even vitamins and supplements, yeah, because those can interact too.
Oh, wow. I didn't know that.
Yeah, it's all about being thorough.
And what about when you're giving medication to children?
Oh, yeah, kids, that's a whole other ballgame.
Right. Safety and dosage are like huge concerns.
Huge concerns, yeah. You got to be extra careful with kids.
So what are some questions you should ask?
You always want to ask, is this safe for children?
Okay.
Or what's the correct dosage for a child of their age? Because kids' dosages are often very different from adult dosages.
Right.
They're usually based on weight and age.
So you never want to just assume.
No, never assume.
Okay.
Always ask the pharmacist.
What about those times when you forget to take a dose?
Oh, yeah, we've all been there.
Right. Life happens.
Life happens, yeah.
So what should you ask the pharmacist in that situation?
So it really depends on the medication and how often you take it.
Yeah.
So the best thing to do is ask, what should I do if I miss a dose?
Okay.
And they'll give you specific advice.
Yeah.
They might tell you to take it as soon as you remember,
Like
or
to
maybe
repeat it.
skip it,
Yeah.
or take an extra dose later.
Yeah, it really just depends.
It depends, yeah. So always check with them.
Another important thing to consider is alcohol.
Oh, yeah. Alcohol and meds don't always mix.
Right.
So you definitely want to ask, can I drink alcohol while taking this medication?
Okay.
Because some medications can have really dangerous interactions with alcohol.
Right.
You could have increased side effects.
Yeah.
Or the medication might not work as well.
Yeah. So better safe than sorry.
Always better to ask.
And
Yeah.
finally, it's natural to want to know how long it'll take for the medication to start working.
Yeah, we all want to feel better ASAP.
Exactly. So how do you ask about that?
You can just say, how long will it take for this medication to work?
Okay.
And they'll give you a general idea
Yeah.
of when you can expect to start seeing results.
And then what if you're curious about other treatment options?
Oh, yeah, good question.
What do you say then?
You can ask, are there any alternatives for this medication?
Okay.
Maybe you don't like the side effects of the one they recommended.
Yeah.
Or maybe it's too expensive. So
Mhm.
there might be other options out there.
So it's good to ask.
Always good to explore your options.
And if you have a really specific symptom,
Yeah.
like a rash, being precise with your question can be helpful.
Totally.
So instead of just saying, do you have anything for a rash?
Yeah.
You could say, do you have anything for this specific type of rash?
Exactly. Yeah, the more specific you are, the
Yeah.
better they can help you.
Makes sense.
And then for medications or devices that have
Yeah.
specific instructions, like an inhaler
Yeah.
or certain creams,
Mm-hmm.
don't be afraid to ask, can you explain exactly how to use this? Host speaker.